Okay. Hey everyone, I'm Ashu Jeffrey, and welcome back to the Healing Space podcast. The Healing Space podcast is a space where we host honest, informed, and meaningful conversations about health, healing, and the systems that help support human life. Today's episode is a very special episode because we'll be discussing a part of healthcare which often remains invisible until it becomes urgent. That is blood transfusion. Blood transfusion is no mere medical procedure. It's a life-saving technique often used in childbirth, surgeries, emergency medicine, just to name a few. But that notwithstanding, in many parts of the world today, access to safe and timely blood is still a very big issue. To discuss that, today we have the incredible Dr. Steve, also known as Dr. Blood, who is one of the leading blood transfusion specialists in Cameroon, where he not just saves lives on a daily through his expertise in blood transfusion medicine, but he also navigates the real life challenges of blood availability, infrastructure, and awareness. If you're someone who is into healthcare as a worker, a student, or you simply just want to know how lives are being saved every day and how you can contribute to that movement, this is definitely the episode for you. But before we get into that, Dr. Steve, first and foremost, I'd like to thank you for accepting my invitation to feature on this platform and for sharing your expertise with us today. I would just like if you could introduce yourself to us briefly, tell us about your journey, especially what led you into transfusion medicine and how you ultimately became Dr. Blood in Cameroon.
Thank you, Jeffrey, for this. I would say the introduction maybe does not depict me leading transition specialist in Cameroon. Well, I'm not really certain. I think I'm just contributing like many other experts in the field in Cameroon and the rest. And we really have big leaders which were following their who we are following their trend. Thank you for
Okay.
creating this podcast to be able to raise awareness on this important issue, which, like you rightly said in your introduction, it seems invisible until you're the one in front of it. And so, what led me into this particular space? I'm going to say honestly, I had never thought I'm going to be in this space from the onset. I had vowed to be an orthopedic surgeon after my years in medical school, and for some reason, once I was almost finishing my medical studies, I had a patient who was in need of blood, and I was kind of in a remote village. And back then, as medical students, honestly, we are never taught how blood is obtained. We are just taught how to use it. And so it had never crossed my mind how we actually get this blood. In pharmacy, you are told to prescribe paracetamol, ceftriaxone. Someone at the pharmacy goes and procures it somewhere and put in the pharmacy. But blood, we've really never thought about it. And so that day, the patient had very low hemoglobin. That is, the blood level was so low, and the child was very, very had shortness of breath. And in that period, the hospital didn't have a blood bank because it was kind of a remote health center. And one concept in that village was the fact that if someone else donates blood to that child, it's kind of the spirit is going to live in that child. And I found it very absurd. And so we had very few people who wanted to donate. And I, being the leading physician in the hospital at the time, I would say I kind of overthrew the lab scientists because I was not fit to donate back then, but I forced myself to donate. And in that process, I found myself that I had collapsed. I didn't know why. And typically, I was playing that because I was very tired. So I got up in the donation process, and getting up, I heard the child was dead. Back then, as a doctor, you have many deaths, but that particular one really pricked me. And so 7 months came by, and then I was given a file when we were volunteering because I was started when I was volunteered for an NGO, Hero Cameroon. And my first project was to organize a blood drive. And the success of that blood drive, to me, I didn't see it as a success, but as days went by, it became many people came back to me asking me to find donors, and I wasn't understanding why. And that's how I did the switch, did my research, and I totally moved into blood transfusion. I got finished my medical studies, went and studied abroad, came back, and working now in Cameroon, trying to share back with the community and trying to move things forward. But I didn't just end there because Hero Cameroon was kind of more of health, public health kind of um, uh,
Yeah.
organization. I decided to kind of create what is called Bloodtrack that was solely dedicated to kind of solving this blood crisis, kind of making people aware, kind of making donors. And so that journey today, it's been, oh, this 2016, so 2026. So it's been 10 years I've been on that
Nice.
journey. And that's how I'm here today. And that's how I'm happy to be able to continue with this movement.
Okay, thank you so much for that. You have said so much, but before we get into the details of what you've just said, I'd just like if you could briefly explain some concepts because obviously there'll be someone watching this who
Oh, yeah.
has never deeply thought about what blood transfusion is, what blood donation is, in fact, the whole concept behind transfusion medicine. So, how could you simply define those terms to them?
Okay. So blood transfusion, I think most people know the term transplantation or the donation, organ donation. So blood transfusion, it's simply removing blood from a healthy person who has gone through a step series of processes, evaluated by medical personnel, gone through some testing and found deemed to donate. It can be a male, it can be a woman or a man, whatever. And this particular, the blood is taken, is processed. Processing now, the process of processing is kind of making it safe, and that's what people have to understand because blood is not just gotten from a person, it's your father to the child directly. So it has to go through a series of steps, and that blood is now given to somebody who needs it, and that's now called a recipient. So that entire process is typically what is called blood transfusion, and it can happen for different components. It could be for the entire blood, it could be if they separate it, and typically for one donation, as we usually as the motto usually says, one donation can save three lives, but I would say it can save even more than three lives. We'll have to go into the nitty gritty of what happened. So that's a bit what blood transfusion is all about. And what most people don't understand is they only tend to hear that process when the hospital actually tells them we need to transfuse your patient.
Would you say there are any criteria for like someone to donate blood or for blood to be given? Because there are specific situations in the hospital where blood is reserved for.
Yeah.
So, what are those situations? And also, what are the eligibility criteria for someone to give blood?
Okay, so if we have to start for those who need blood, like earlier said in the beginning, blood transfusion really cuts across many medical disciplines, from pediatrics, children, especially in Africa, severe malaria often comes with anemia, and so they need to be transfused. If we go into maternity or obstetrics, so we have a lot of women bleeding. We have people who are actually women who kind of lose a lot of blood due to delivery. They will need blood. If we go into internal medicine, that is the medical specialty, we have people who have chronic kidney disease, people with sickle cell disease, people with cancer. If we go into surgeries, people who are about to undergo surgeries, people who bleed from particular surgeries. In fact, when we realize all medical disciplines, I always tell my colleagues the only discipline that doesn't really require transfusion is psychiatry. At the moment, maybe in the long term, we're going to see that psychiatry might need blood transfusion. But at the moment, almost all disciplines need some sort of transfusion. And now, who are those able to donate this particular blood to put in the blood bank? And that's where the concept of voluntary blood donation comes. First of all, it has to be somebody who's willing, depending. Every country has their own law, and that's what we have to understand. And this law kind of is framed from the World Health Organization, which kind of gives kind of a roadmap to kind of follow. So in terms of weight, you have to be at least weighing above 50 kilograms because a particular quantity of blood has to be taken. The second thing which you have to be healthy. That is the first question which is always asked is, are you healthy? Because if you have a cold, if you have maybe an infection, for that moment you will not be told to donate for a particular
Okay,
period
so
of time.
the slightest medical imbalance makes you ineligible to
Yes,
donate blood.
exactly.
The slightest,
Because
even if it's just a cough.
yes, because we don't know what causes the cough, and that cough could be bacterial, it could be viral, which can be found in your blood. And so, typically, if you transmit it to somebody else, it can be dangerous. Even for your own person, for your own safety, you can't be sick and then they are moving blood from you, basically. And
True.
that's why you have to be healthy. So there is a weight, basically. There is the fact that you have to have what is called vital signs, your blood pressure, your pulse, your temperature, they all have to be normal. You have to be someone who has not undergone any surgery for a particular period of time. You have to be someone who's, I would say, your lifestyle is very important because the questions that are being asked is really in terms of we are trying to find out if you are exposed to diseases which can be transmitted through blood, but which are not going to be detected with the test we use. And this could be something, for example, if you have multiple sexual partners, if maybe you are having a partner who's having one of the most common, someone who's having HIV, hepatitis B, hepatitis C, or come close in contact with that. If you're maybe sharing needles with somebody, for example, if you're on hard drugs, for example. So all those particular things makes you ineligible. And then for females, added to that, if you're on your menses, if you're menstruating, you, depending on who is evaluating you, you're not allowed, because at the current state you're losing blood. If you're breastfeeding, depending on what month of gestation you are, you will not be allowed. If you're pregnant, you will not be able to to donate blood. So there are a lot of, in fact, there is a questionnaire which is given depending on the country. It could be 4 pages, it could be 1 page, and all those questions are out to test if you are eligible to donate. So it basically, in a nutshell, there is a bit what you have to be healthy. You have to be weighing above 50 kilograms. Your blood pressure has to be okay. You're not supposed to be taking any sort of medications. And for women, not on your menses and not pregnant and not breastfeeding. So that's generally what it looks like.
Okay, so to follow up on the whole donation idea, how exactly will you, from your experience, how you describe the level of awareness, especially in Cameroon, when it comes to donating blood and all the procedures involved in blood transfusion medicine?
Whoa, that's a very big question. In terms of awareness, I'm going to say it's more of kind of a pause, right? Because the only time where we have intensified awareness is during the World Blood Donors Day, June 14th. That's where the whole nation knows about. In fact, those who listen to news will know about blood donation. But once that week is over, everything goes down. And we had carried out a research, and I'm going to say from the research we had seen, we noticed that this research was done when we carried a blood drive, that we actually missing out a lot of donors because we're not talking about blood donation. Because amongst the donors who finally donated, 25% of them said they had never been asked to donate and they had never heard about blood donation. But the fact that we went to them and told them about blood donation push them to kind of come and donate. And so I'm going to say there is a lot of work to be done really on just this awareness part, be it through social media, be it on the one-to-one talk, be it through radio. I mean, both traditional and the new ones, we have to use all the outlets possible to be able to increase awareness. There is really little awareness, especially like you said, for those who have not been in contact or who have not been at the constraint of having to find a donor, especially in Cameroon or especially in Africa where we have very, very few voluntary donations. And this means that we tend to rely a lot on family donors. So voluntary donations are simply donors who come without having to ask for emergencies and stock up the bank, right? So it's just like if you have money cash and you have to take this money to the bank to keep for you, somebody else will use that money to run his business, right? So what happens to the blood bank is voluntary donors have to come and give blood so that it can be used to run the hospital. But basically, we don't have that, and then we are suffering a lot.
That's true because I was doing my research prior to this and I noticed that part of in fact, the main contributing factors to the inavailability of blood, first of all, is that there is either no awareness or the infrastructure is poor, or there is awareness, but people like the availability of the blood at that situation is not yet there. So, during your time as a blood transfusion specialist, especially in Cameroon, which of these three factors, availability, awareness, and infrastructure, will you say has really impeded your service?
Availability, awareness, and infrastructure. I'll, I'm trying to think one because you have to look at the consequences. Which one gives kind of more challenge. So I would say more of, because awareness. I will still end up with awareness. Yes, because the truth is awareness is the difficult part. It's a difficult part because it takes a lot to convince somebody to donate, and so people don't want to do that.
True.
People can easily fund a blood donation campaign. Like if you go a GoFundMe, people fund a blood donation campaign, and typically many donors tend to come out when there is an emergency. So if you like write an SOS today, okay, we have this 2-year-old person dying, a lot of people come out. So for example, during the Iseka incident where we had the train that crashed, we had so many people who donated because they saw the emergency, they saw the need. And that particular thing, it told us that donors are not lacking, but typically they probably not hearing the right message. And so we have to work more on the awareness and what we are telling these people for them to be able to do it and how we treat them. Obviously, infrastructure is going to come with it because if somebody wants to do it now, how does he get to the bank? How does he get the information? How does he get to know? the material needed to be able to get this blood. So in that order, I'm going to say awareness, infrastructure, then availability. Because if you're not aware, if there's no infrastructure, definitely it's not going to be available. So this, I'll put it in that order according to what I see, according to what I've discussed with other colleagues around the globe in Africa and the rest. So we have to work a lot on awareness, then put the infrastructure possible such that someone who is aware can use infrastructures, which is now going to
So
lead to the availability. So that's really what I'm going to.
so
That's my
true.
take. Yeah.
Yeah, it makes so much sense. To double down on this awareness thing, through my research, I noticed that there's also a lot of misconceptions around like blood donations and blood transfusions, more especially when it comes to Africa. I thought it was only just for Africa, but I noticed even in the Western world. I was watching something yesterday, a friend sent to me, where there was a patient whose parents refused for the blood not to be transfused to him. Apparently, they were from one certain religion, and the religion says like blood from one cannot be in another, if not the spirit. The same thing you said during your intro,
Yeah.
where
Yeah.
if there's transfusion from one to another, then the spirit of the other will be in the person who has been transfused. And I was just like, I don't know. Sometimes religion is supposed to be a good thing, but it's doing more harm than good these days, because what's the meaning of that?
So,
And
anyways, I yeah, can go on.
and it just led me to think like, if that's in the West, then what more of a situation where like you work in Cameroon? What are some of these very common misconceptions that you get about the blood transfusion mechanisms
Yeah, so
as
exactly,
a
and that's what I was telling you at the beginning, that I think awareness is a more difficult work. Because imagine you have to meet somebody who has all of this in his mind, right? You have somebody who already knows that, okay, what you're telling me, you're just pouring water on the devil's back. Because I have heard that you guys are selling blood. I have heard that if I donate blood, I will die. I have heard that if I donate blood, I will get infections. And so that work, it's so difficult for you to kind of, to make someone to unlearn what he learned and get the right thing, the right thing straight. So that's the truth is that the fact that people feel like we sell blood, I think to me is the highest deterrent. Is the highest thing that differs people from donating voluntarily. And that's because when you want to compare in the West and in Africa, in the West they have social insurance, right? And so when somebody needs blood, you are not told to go and bring a donor. You are told that blood will be given and then X amount is going to be charged. But that amount is actually charged for the test and the processing which is going to be done. But in places where we don't have blood in the bank, what are you going to charge if it doesn't exist? You can't charge blood that doesn't exist. And so you have to tell the person, bring us the person to be able to bleed. And so in your mind, you know that the person they are bringing, it's totally free, it's totally safe. So if I've made it available, it's actually safe, which is not actually the process. And so most people, when you even organize blood drives, they will say, you guys will go and sell my blood in the hospital. And so you have to be able to deconstruct the fact that that blood is not actually being sold, but it's actually a cost given to that person. So that's one of the first things which I think blocks a lot of people from donating. The other one which you talk about religion is it's something which it's kind of a gray area, because for those who are believers, you can't separate the spiritual from the physical, and one leads to the other. And so, being a medical professional, you understand the importance of ethics, you understand the importance of respecting one's choice. And that's one fundamental pillar when it comes to transfusion. You can't go against the person's will. You just have to tell the person these are the consequences from a medical perspective, because I can't argue from a spiritual perspective. I am not a priest. If I were a priest once I'm back, I will be talking from a spiritual perspective, because there are priests who are doctors, so they can't take the
True.
priest thing and mix them together. So in the medical field, personally, though I have my own beliefs as a spiritualist, or as someone who believes, I can't take that when I'm doing medicine. I have to be able to know when to separate both. And so I'm going to say it's going to be based on wherever you are found that unfortunately you have this. But on that aspect, there is one aspect which is called patient blood management, which is actually a new novel. It's not actually too novel, but it's really a way of how do we treat these patients, because the end goal is to have the patient restore his health. Like you actually said, this is space for healing and the rest. So it's not only blood transfusion. In fact, blood transfusion is not even the final solution. Blood transfusion, like we always say, it's kind of and it's a supportive treatment which is necessary for us to be able to manage the cost. Because if you don't treat the cost, then you've not done anything. And so for those people, we try as much as possible to use other alternatives which exist for them, such that we can, at the end of the day, have a comprehensive treatment. But we have to know that there is space for the transfusion and there is space for those who don't want transfusion.
Okay, so for people who come and do not comply to the whole blood transfusion thing, what are the other treatments that are being developed to help them also be restored to natural health?
All right, so it's going to depend on how the patient, on how the what was the patient's clinical state, because transfusion typically is required in emergency. Emergency means that without a transfusion you are dying. And unfortunately, most people who have reached that stage and whom we have asked to transfuse and they've denied the transfusion, unfortunately they have died. And so for those who are compensating, for those who are able to breathe normally without any difficulties, even though their blood is low, there are alternatives. And the first thing is that we have to find the cause. Finding the cause is the first thing you have to do. So it could be maybe because the person has had nutritional deficiency, that is iron deficiency, due to severe blood loss. You might want to check that. And what we've noticed in our setting here in the hospital is that most people kind of are transfused because they have what is called this gastric, right? And this is upper, that is the kind of vomit blood or they are stolen blood without knowing. And when they come, their blood is so low. So if we prevent that in the first place, and that's what is called a treatment already before the transfusion, we kind of prevent them from falling into these diseases. In women, it's unfortunately cervical cancer or breast cancer, which kind of the leading cause of transfusion. In our setting, it varies per setting. The other method in which you can use the result is called auto transfusionism. You can donate blood to yourself, basically, especially for those who are going for surgeries, right? And that's now it depends on, like I said, it has to you have the setting, you have to meet a minimum criteria. Your blood level has to be a particular level. You have to donate your blood 2 weeks before the surgery, minimum. Then they have to do some particular follow up and so on. The day of the surgery, your blood is given back to you, and then everything moves on. So that's a particular way which is being
Oh, okay, okay.
which actually being used. The other way is actually using blood tonics. It could be tablets, it could be intravenous iron, depending on the cost. Like I said, you could have folic acid, you could have vitamin B12, you could have erythropoietin for those who have chronic kidney disease who are putting place on. So it depends on what category you fall on, basically. But basically, those are the things which are actually being used. And there are three main pillars which you actually use when we want to do that. But I won't go into the details. But typically, we should know that there is what we can do for them. But if it's
Okay.
emergency, for the moment, we've not seen something else. However, there are new developments of things which are called biological oxygen carriers, right? So they mimic blood, but it's not actually blood, because the function of the blood in that case is to carry oxygen to the parts of the body that doesn't have oxygen. And so those
Sure.
particular products help to deliver oxygen in those particular parts. And for those people who have issues with transfusions, they are actually compatible to take that particular product if the indication of the transfusion requires oxygen than the other parts, because blood, there are several different indications. I hope it answers a little bit the question.
Yeah, yeah, yeah. It does. It does so much. Thank you. Now please. How long have you like been in the blood transfusion space?
I would say I started in 2016 in medical school. That is already been on the field and awareness, and
Mhm.
practically as a specialist, it's been this is my 4th year. Yes,
Okay.
but being in the field of this thing, I'll say cumulatively 10 years that I've been talking to donors, helping put these things together. Yeah.
Okay. So because you work in a very critical side of the healthcare field, I would just like to ask, like, what's that one moment throughout your time of service that has really stayed with you and always comes back to remind you of the significance of what you do, not just for yourself, but more especially for those you do it for?
Okay. What's that significant time? All
You
right.
mentioned
So
at the beginning the patient you lost in that
yes,
village.
yes, but back then I didn't really see it. I mean, I connected the dots backwards. That's because it's backwards that I connected that I was good in this. People were soliciting me for this, and that's why I joined there. Because back then I was like, no, I'm still going to follow my auto career. The
Yeah.
thing that really, I think one of the defining moments for me that reminds me why this job is important or why this thing is important, it's first of all, I run a sickle cell clinic, and in sickle cell clinic, typically you always have patients who call you for these particular situations. And there is a patient I still remember. Obviously, I can't divulge his name, but he was
Yeah.
5 years old. He came and they called me. His hemoglobin level was typically hemoglobin is supposed to be about 10 or 12. His own was 2, and he was in coma. And immediately we asked for blood, just a little, because as little as 300 cc's, just a little, like this Coca-Cola juice, small thing that you drink.
Yeah. 350 ml.
As soon as we gave the blood, he came out of the coma. He became better. he had a septic infection from an abscess. He had a surgery, and today is 2 years since the incident, and he comes every day in the clinic and he's talking. And I think that's what those are kind of moments that really remind you why I'm doing the thing I'm doing, why I need to push the boundary to be able to make people donate. Because when you're donating, you don't also the front line these scenarios, because irrespective of how much that family had, if they had 2 million francs, if they had 5 million francs, if they had 10,000 million US dollars, if there was no blood in the bank at that time, in a matter of
This guy.
seconds, we would have lost him. And so those particular moments define really why I'm doing this and why I kind of wear several hats to be able to address this issue. So that's just one of the many moments I'm going to say.
That's really, really lovely. But there's several hats which you just mentioned. I would like to connect now to one of them, which seems to be like the most important one to you now, Bloodtrack. What inspired the creation of the organization?
Honestly, Bloodtrack, I tend to, when I tell people, they always feel like I'm joking. Bloodtrack, I think it's God's project. I am simply at the front for the moment because there are things that happen there. I don't know how they happen. I don't know why they happen, but they happen. But if you have to put how it started with a group of four. We were four of us in class, and I simply just wanted to kind of resolve this pain, resolve the fact that people kept calling me and they don't find donors. So initially, just wanted to be a platform to connect donors to patients initially, and it started as a team of four. Today we're a team of 30 across 5 regions in Cameroon, and they're doing diverse activities along the line. And each time something new happens, we've just been putting these patients at the center of everything we do, trying to think how what can we do to make them better, but not only the patients, but even the donors, because like our vision says, we are trying to create a world where no one dies from blood shortages. And so when we started back this in 2018, the whole idea was, we're going to create a health platform to be able to solve the blood crisis in 5 years' time. Well, I think I was my ambitious because I didn't know how big the problem was. And so, like every big entrepreneur was like, no, I'm going to solve this issue and everything. And it's 2025, and still, we are not still there, but we've made significant progress because the team members have had. Because honestly, Bloodtrack is not me. Maybe I'm not even sure people know that Bloodtrack is me. I remember one time people asked me whether I was a member of Bloodtrack, and I felt very happy because it's like, okay, it means they don't even know what's happened. Like, because many people have taken upon themselves this vision of actually helping people. And so it's been 5 years now. We've been able to kind of respond to several SOS. We've been able to kind of organize several blood drives. But beyond that, we've been able to put the donor at the center, trying to educate them better. And our target is really the youth. Because, like I told you initially, the awareness part is difficult. And so we realize that between educating somebody whose mindset is already kind of frozen and someone who is fresh, we prefer to go where people have no idea about what blood donation is and give them the right information. And so that has been our target so far, and it has been reaping fruits. I'm grateful to all my team members. I'm grateful to the people God have sent on this journey, and we are really aspiring. In fact, right now I'm going to say we are more of, if we have to put in the field of this the field of what we actually do, I would say we are more of a social marketing agent for blood donors. So we are trying to intensify this awareness, getting the right message to the right people at the right time. Because at times people feel that if you see 200 people at the blood bank, all of them are eligible. So we are really trying to create such that whosoever wants to organize a blood drive, we can help you to get the people who are fit, the people who are necessary, the people who will help you evolve in your project. And so that's a project, that's a global issue, and we are planning to expand it. Why not? Because we are working with other people around the continent. But basically, that has been kind of a hat which I don't know which I'm never going to leave, but it's who I am today and it's what I'm doing.
This year, do you guys have any special project or target you guys would like to accomplish in 2026?
Yes, so we've taken a bigger step. I'm going to say a step which I've never thought is going to ever happen. So we've partnered with the Cameroon Medical Student Association. And
Interesting.
what we are now moving into, it's we're trying now to not only have donors, but to have health professions join this particular thing. And so what we are planning to do, we are planning to have the first exchange visits between countries. That is medical students who will leave Cameroon and go and visit a blood service, a blood center, let's say for example in India or in Kenya, or to be able to have an idea of how blood service work, hoping that it inspires them to become hematologists or blood transfusion scientists at the end of the day. Because I cannot do this job alone. Like you earlier said, I'm a leading transfusion expert, but I told you there are so many people, but we need many more in the team. And I think if I got my inspiration as a medical student, we are really working very hard for to make this happen for the first time. We are planning to move into education wise, so with still with medical students to kind of have education talks on awareness. We are planning already on celebrating the World Blood Donors Day. But we really have two mega projects which are on, which we've called them Donors Hub and the Dummies, which is kind of an application, or let's say that tool, which like I told you will help people to have better donors. So those are the big 2026 projects and plan. But like I said, it's God projects at times. There are things that pop up that I don't plan and they happen. So let's see what the year has for us.
Just to be sure, sorry, just to be sure, you said the two major projects are to increase the donor hub by partnering with different professions in health science, and the international exchange for students.
Yes, so international
Isn't
exchange
it?
of students with medical students more specific.
Okay.
That's one of the goal we are working on, and the second one is the donors hub, which is really what we are talking because our vision is creating a world where no one dies from blood shortages by building a valuable community of blood donors. So it's that valuable community of blood donors, which is our donors hub, which we're actually kind of just going to mature with.
Okay. So, from what I know, you organize an annual training program for blood transfusion specialists.
Oh yeah.
How important do you think that program is, especially right now in like the Cameroon context or in the African context?
I'm going to say it's so important because the experts in the field of transfusion are so few. In fact, they are dotted. And the few who are there are into various things because transfusion might seem small, but if I have to discuss transfusion today, I'm never going to stop because, and that's one of the hats I wear, which is called the Transfusion Arena Mentorship Program, the TRAM, where I kind of get people who are already in transfusion to help them in their career choices because the field is so big. But in terms of the training we have been organizing since 2024, to be more specific, and we are organizing one again this year in March, I think it's so vital because we need the workforce has to be bigger. And typically, if we have many more people getting interest, if we have many people more invested, because people who have had, people who are already it's the whole chain from doctors to lab scientists to pharmacists to hospital administrators who we are training based on a particular topic. And so this particular training, I think it has to be not only done in Cameroon, but it has to be multiplied all across Africa because the level, in fact, even when you look at the level of specialists in transfusion medicine or hematology, there are very few. In fact, to the best of my knowledge, currently at the moment in Cameroon, I can't count up to 10 clinical hematologists, right? So I
Hmm.
am not a hematologist like I tell people, but I am in the field of hematology, but more in transfusion medicine. And so when you look at the
Okay.
clinical hematologists who exist, I'm maybe 10, it's because maybe I'm just giving a latitude of about five that I might not know. But the ones I know, they are typically four, whom I know, two of whom are my professors that I've actually be holding my hands in this. So it's very important for us to kind of not only give awareness to the community people, but we also have to work on the science because I mean, if India is where it is today, it's because of tech and science. And so we have to be able to reach that space. And we need more people to be aware of this. And you know what? Get more experts so that there's not going to be one leading expert, but we're going to have several leading experts in the field to make the things
True.
grow. Yeah.
So true. So, for someone who is watching this right now and is really convinced with the whole movement of what you're trying to do, what do you say they can do to be able to be eligible to attend that program? Because obviously there are standards to be obtained, isn't it? So, what do you think is like the eligibility criteria to be part of the program this year?
All right. So for the program this year, I will talk specifically for the TRAM, that is the Transition Arena Mentorship Program, for those who really
Yeah.
want, because the aim of TRAM is to give clarity to those who have said they want to be in the transition space, to be able to give tools to those who say they want to solve problems in transition. It could be like a donation issue, like you actually like we earlier said on, and it's more importantly to connect. I mean, there are a lot of we currently we've trained 39 people from 10 different countries, 4 continents, through 3 cohorts. And we've been able to, I mean, connecting them together, seeing how they solve things together has just been most beautiful. But I think the most important thing, which I always look at them, is having someone say that he now knows where he has to go, something which I struggled so much to have that clarity. And so we are going to, the call of applications is coming up soon. We're going to be launching at the beginning of this week for the fourth cohort. It's going to be a link which we're going to share. It's you're going to fill the link, tell us why you want to be part of the program. It's very selective, I must say, because we take just 15 people because we really want to have quality time for the training. So it's going to be launched.
Quality over quantity.
Yeah, quality because yeah, we prefer quality because those who have the quality have the urge to go beyond the excitement and the rest. So 15 slots are going to be available for this particular session, which is going to start in February. It's going to run for 2 months, always 2 months, and the link will be shared on. We typically use LinkedIn for the moment, but we're working on having our website running up and running. So Transfusion Arena Mentorship Program for Leadership, TRAM, basically. I'm working with two Indians.
Is it on-site? Is it an on-site or online
No,
program?
it's virtual. It's totally virtual. Everything is virtual. We have mentors who come. We have mentees. I mean, we connect you with mentors who are from different parts of the world. We bring experts on the call and everything. It's virtual, helping you to connect at any
Okay.
point in time.
Okay. And lastly, what's the impact that you have seen of this program on those from past participants? What have they gone out to do, which you can really look at and be proud of that all this stems from the TRAM program?
Oops. So I'm going to say I am always somebody who likes long term rewards basically. So the Trump program basically, like I even told, when I discussed with my partners, I tell them the rewards, we're not going to see the rewards now, because if we're trying, because the whole aim is to build leaders. We want to put people at decision tables, because I've been on decision tables and I've seen the impact that it has had alongside. But so far, we've had a couple of people. Most 90% of the people who have gone through the program, at least they've had clarity on what they want to do in transition medicine, and that's really what's important. Because once you know where you want to go, the rest, connecting the dots, it's very easy. But I think one of the participants really she told me that she's going to lead one of the societies, one of the international societies, and that's all. Like, okay, that's what we are looking for, because we're looking at people who want to be leaders, be able to make the field grow. Because in as much as we want people, we need more leaders to be able to make the world go round. So I haven't yet seen the result I want Trump to be at the moment. It's just 1 year old. We started in January 2025. So they're still short term, but it's really going to be kind of a 3 to 4 year down the line that will be able to see this, to see the fruits of this particular program.
Yeah, and hopefully those fruits come and they come in abundance.
Amen. Like you said.
Yeah. So sadly, we have come to the end of this very fruitful talk, I must say. And before we close, I would just like to appreciate you in particular, Dr. Steve, because this is not the first time we are seeing on this platform.
Yeah.
The first time there were so many issues that we had to do a retake. So I thank you very much for the fact that you didn't just come once, you came twice. And the things you constantly do to help us evolve. I remember telling my father that the message I received from you on New Year's Day was like my very my peak of the day. And honestly, it was because I didn't just see it as Dr. Steve sent me a New Year message. I saw it as the founder of Bloodtrack sent me a message. Maybe to you it's not a big thing, but to me it's a very big thing. And I would just like to thank you for that. And yeah, the Healing Space podcast will always be a platform which will promote and support Bloodtrack and Shram. And yeah, we are forever fans of Dr. Steve. So thank you very much for your
Thank
time
you
and
for
for your
having me,
support.
and thank you so much. And I
Yeah,
will say courage to you. Don't mind the views you have now. Don't mind the number of likes you have now. The idea is just be consistent. There are going to be ups and downs and everything. Don't get discouraged. Just build your system, and don't rely on willpower. Build on your system, and then everything is well. And thank you for having me, and continue doing the great job you're doing, Jeffrey.
thank you very much. So
Thank
guys,
you.
thank you very much for watching. Please share, like, subscribe to the channel, and we'll see you next time. Thank you very much. Okay. End record.